Hello everyone, and welcome back to our channel, your space for learning, sharing, and growing as future nurses. Today we're going to discuss about a very special and meaningful topic: transition to parenthood. In this video, we'll explore what the transition to parenthood means, the physical and emotional adjustments parents experience, and how nurses play a vital role in supporting families during this stage. So, grab your notes, stay tuned, and let's learn together. And don't forget to like, share, and subscribe, so you won't miss out on more nursing insights. Let's imagine this for a moment. A new mother has just returned home after giving birth. Her body is still healing, she feels sore, and she's trying to manage sleepless nights. This is the stage of physical recovery for the mother. These emotions are completely normal during this period. As nursing students, it's so important for us to recognize this transition. It reminds us that parenthood is not just a medical journey. It's an emotional and social one too. And that's exactly where our role as supportive caregivers comes in. Transition to parenthood means the changes parents go through when a baby is born. It includes 3 parts: psychological, for example, feelings like joy, stress, or worry about being a parent. Then, social, changes in family roles, relationships, and daily life. The last one is physical, the mother's recovery, and both parents adjusting to less sleep and new routines. In short, it's all about learning, adapting, and growing into the new role of being parents. The transition to parenthood is very significant because it's the time when parents build a strong bond with their baby, adjust to new family roles, and take care of their own well-being as mother and father. This period doesn't just start after birth, it actually begins during pregnancy and continues all the way through the first year after delivery. So it's a long process of learning, adjusting, and growing together as a family. Now let us discuss the phases of transition to parenthood. The first phase is called the anticipatory phase, which happens during pregnancy. In this stage, parents begin preparing both emotionally and practically for the arrival of their baby. Some common activities include attending antenatal classes, buying baby supplies, and learning about infant care. At the same time, there are also psychological changes. Parents may start imagining what the baby will look like, adjusting their self-image as future mothers or fathers, and planning for new family routines. This phase is all about preparation and expectation, laying the foundation for parenthood. The immediate postpartum phase begins right after delivery and lasts for about 6 weeks. During this time, a new mother's body is focused on healing and recovery, from the uterus shrinking back to its normal size to adjusting to changes after childbirth. She is also learning how to care for her newborn, feeding, bathing, and soothing the baby, while coping with frequent night waking and sleep deprivation. Hormonal shifts are significant during this period, affecting mood and emotions. Many mothers experience a mix of feelings, from joy and excitement to anxiety, fatigue, or ambivalence. Mild mood swings, known as baby blues, are also common in the first 1 to 2 weeks. Overall, this phase is all about physical recovery, learning infant care, and adjusting emotionally and hormonally to the new life ahead. Now, we will see about the last phase of later postpartum, or parenting phase. The later postpartum, or parenting phase, begins after the early weeks of recovery and focuses on long-term adjustment. This is when new parents truly start to integrate their parenting role into everyday family life. It's a period of building confidence, learning to trust their instincts in feeding, soothing, and caring for their baby. Parents also face the challenge of balancing work and family responsibilities, reshaping routines to meet both personal and professional demands. Another important part of this phase is redefining the couple relationship as partners navigate new roles, shared responsibilities, and changes in their emotional connection. Overall, this stage is about finding balance, gaining confidence, and creating a strong foundation for family life. Parenthood doesn't just bring physical changes, it also brings major psychological adjustments for both mothers and fathers. Here we will see about the psychological changes for mother and father as a parent. For mothers, this period often involves a redefinition of identity, shifting from being just a woman to embracing the role of a mother. Along with the joy and happiness of caring for a newborn, many women also experience fatigue, worry, guilt, or frustration. Some may even face challenges like postpartum depression, anxiety, or concerns about body image. Fathers, too, go through their own adjustments. Their role often focuses on supporting their partner, providing financial and emotional stability, and stepping into the responsibility of parenthood. Emotionally, they may feel joy and pride, but also anxiety and a heavy sense of responsibility. At times, some fathers even feel left out as the spotlight shifts to the mother and baby. These adjustments are normal, and acknowledging them is the first step toward building a healthy family dynamic. Paragraph. The transition into parenthood is influenced by many different factors, so here we will see the factors influencing transition. On an individual level, things like a parent's age, number of previous pregnancies, physical health, and even personality can shape the experience. The partner relationship is one of the strongest influences in the transition to parenthood. Emotional support from a partner helps reduce stress and feelings of isolation. Sharing responsibilities like diaper changes, night feedings, or household chores prevents one parent from feeling overwhelmed. And open communication makes it easier to express needs, frustrations, or expectations without conflict. Family and social support play a powerful role in the transition to parenthood. Help from extended family, like grandparents stepping in to babysit or cook meals, can ease the daily pressure on new parents. Peer support groups also provide encouragement. Just knowing other parents are going through the same sleepless nights or feeding struggles brings comfort and reassurance. Community resources, such as parenting classes or health clinics, offer guidance and practical advice. For example, a mother struggling with breastfeeding might find confidence and relief after attending a local support group or speaking with a lactation consultant. These forms of support remind new parents that they are not alone and that a strong support network makes the journey much smoother. The baby's own factors are just as important in shaping how parents adjust to their new role. An infant's temperament, for instance, makes a big difference. Some babies are calm and easy to soothe, while others may cry more often or need constant attention. Health concerns such as colic or prematurity can add extra stress and require more specialized care. Feeding difficulties, whether with breastfeeding or bottle feeding, can also leave parents feeling frustrated or worried. For example, a baby who refuses to latch might cause the mother to feel anxious, while the father worries about the baby's weight gain. These challenges can be overwhelming, but with patience, support, and guidance from healthcare providers, parents can gradually adapt and gain confidence in caring for their baby. And finally, cultural and societal expectations play a powerful role in shaping the parenting journey. Traditions may influence how a mother and baby are cared for in the first few weeks, while gender norms can affect who is expected to take on childcare or household responsibilities. Parenting beliefs, such as whether to co-sleep, breastfeed exclusively, or return to work early, often come from cultural values or societal pressures. For example, in some cultures, mothers are expected to stay home with the baby, while in others, returning to work quickly is the norm. These expectations can either support or challenge new parents as they find their own rhythm. Together with personal, family, and infant factors, culture and society ultimately shape how smoothly or how challengingly a family adapts to this new chapter of life. Parenthood is a beautiful journey, but it also comes with challenges that almost every new parent faces. One of the biggest is sleep deprivation and fatigue. Newborns wake often, and the lack of rest can leave parents feeling drained both physically and emotionally. Along with this comes role strain and identity changes. As parents adjust to balancing their new responsibilities while still holding on to who they are as individuals. Relationships between partners may also be tested during parenthood. The combination of sleepless nights, constant baby care, and less personal time can increase stress and make small disagreements feel bigger. Differing expectations, like who should handle night feedings or how much help is expected with chores, can also create tension if not openly discussed. For example, one partner might feel frustrated doing most of the household work, while the other focuses only on the baby, leading to arguments and resentment. But with honest communication and shared responsibilities, couples can turn these challenges into opportunities to strengthen their bond and grow together as parents. Postpartum mood disorders are one of the most important challenges in early parenthood, yet they're often misunderstood or overlooked. While many parents experience the short-lived baby blues, some go through more serious conditions like postpartum depression or anxiety. These can bring intense sadness, worry, irritability, or even difficulty bonding with the baby. Fathers, too, can experience mood changes, though it's less often recognized. For example, a mother may feel guilty for not feeling as joyful as she expected, or a father may feel overwhelmed with pressure but unable to share his emotions. The key message is that these feelings are not a sign of weakness. They're a medical condition that needs support. With early recognition, open conversations, and professional help, parents can recover and find joy in their parenting journey. Balancing work and parenting responsibilities is one of the toughest challenges for new parents. Juggling professional duties while caring for a newborn can leave parents feeling stretched thin and constantly pulled in different directions. For example, a parent may need to attend a meeting at work while also worrying about feeding times or a sick baby at home. This juggling act can lead to stress, fatigue, and guilt for not being fully present in either role. The key is finding strategies that work for your family, like flexible work hours, sharing responsibilities with your partner, or seeking support from relatives or childcare services. With planning, communication, and realistic expectations, parents can manage both roles and create a balanced, fulfilling routine. Now let us discuss nursing interventions that support parents during the postpartum period. One of the most important strategies is education and counseling. Nurses can guide parents on newborn care, including feeding techniques, maintaining hygiene, safe sleep practices, and general safety tips to prevent accidents. Equally important is self-care for parents, encouraging proper nutrition, adequate rest, and stress management to help them stay healthy and cope with the demands of parenthood. Nurses also provide anticipatory guidance about emotional changes, preparing parents for the mood swings, anxiety, or baby blues they may experience. Through education, support, and open communication, nursing interventions help parents feel confident, informed, and capable in their new role. When we talk about emotional support for new parents, nurses and caregivers play a key role by practicing active listening and showing empathy, helping parents feel heard and understood. Encouraging parents to express their feelings, whether it's joy, anxiety, or frustration, can reduce stress and prevent emotional burnout. Supporting bonding activities is also essential. Simple moments like skin-to-skin contact, talking to the baby, or gentle play not only strengthen the parent-child connection, but also boost parents' confidence in their new role. By providing emotional support, caregivers help parents navigate the ups and downs of early parenthood with with greater resilience and joy. Now let us discuss the importance of facilitating partner and family involvement in newborn care. Encouraging fathers or partners to actively participate in caregiving, like feeding, changing diapers, or soothing the baby, helps share responsibilities and strengthens family bonds. It also reassures parents that they are not alone in their journey. Teaching siblings how to adjust to the new baby is equally important, helping them understand their role and feel included. Simple guidance, like involving older children in safe baby care or explaining changes in routines, can reduce jealousy and promote a supportive family environment. By involving the whole family, nurses help create a strong, connected, and nurturing space for the newborn. The role of screening and referral in supporting new parents. Nurses play a key role in identifying postpartum mood disorders, such as depression or anxiety, by using tools like the Edinburgh Postnatal Depression Scale. Early screening helps detect signs that might otherwise go unnoticed, allowing timely support. When necessary, parents are referred to mental health professionals for further assessment and treatment. This proactive approach ensures that both mothers and fathers receive the care they need, promoting emotional well-being and a healthier adjustment to parenthood. Now let us explore the role of community resources in supporting new parents. Access to parenting classes can provide essential knowledge on newborn care, feeding, and safety. Support groups offer a space for parents to share experiences, gain encouragement, and learn from others going through similar challenges. Additionally, home visits by nurses or midwives give personalized guidance, helping parents apply what they've learned and addressing concerns in the comfort of their own home. These resources not only increase parental confidence, but also strengthen the overall support system, making the transition to parenthood smoother and more positive. Now, let us look at the outcomes of a successful transition to parenthood. When parents receive proper support and guidance, it leads to positive parent-infant attachment, helping babies feel secure and loved. Parents also experience increased competence and confidence, feeling more capable in caring for their newborn. Early support can reduce the risk of postpartum mood disorders, promoting emotional well-being for both mothers and fathers. A smooth transition also helps strengthen family relationships, creating a more harmonious home environment. Finally, these positive outcomes contribute to healthy child development, laying the foundation for the baby's physical, emotional, and cognitive growth. In conclusion, the transition to parenthood is a journey full of changes and challenges, but with the right support, education, and care, parents can feel confident and capable. Positive parent-infant bonding, stronger family relationships, and healthy child development are the rewarding outcomes of a smooth transition. Every parent's journey is unique, but with guidance and support, this new chapter can be a joyful and fulfilling experience. That brings us to the end of today's session on transition to parenthood. I hope you found this video informative and helpful. Thank you so much for watching, and don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.